Lance was diagnosed with advanced testicular cancer on October 2, 1996. The cancer had spread to his abdomen, lungs, and brain. He started the Lance Armstrong Foundation in 1997, before he knew his own fate. The foundation came out of the desire to help others facing cancer become survivors, not victims, and to provide survivors with the support and resources he wishes he'd had when he was first diagnosed. This was the challenge given to Lance by his oncologist, Dr. Craig Nichols, when he went into remission, to give something back. An obligation never left behind and lived to this day by Lance and by Livestrong. We focus on the person diagnosed with cancer. We do not focus on clinical research. Early on, we connected with leaders in the cancer field to discover what needs were unmet. We sought to fill in gaps rather than drain resources from organizations that were already making progress in important areas. That's why we focus on cancer survivorship. As more and more people are surviving the disease, experts in the field identified the need for support for survivors as a major unmet need that we could lead. We have a number of strategic priorities. We establish cancer as a top health priority. We develop and deploy navigation resources, ensuring the best possible experience for all people with cancer, with an increased emphasis on underserved populations. At Livestrong, we leverage networks of professionals, organizations, and institutions to better meet the needs of people affected by cancer. We believe that research should be patient-centered rather than merely clinical. And finally, we want to build and maintain an engaged community, taking meaningful action on cancer issues around the world. One of our first survivorship grants was investigating the effect that exercise has on people fighting cancer. The research proved a better quality of life and a longer life for people who were active during and after their treatment. This has led us to collaborate with the YMCA network, and we have one staff person who oversees an extensive exercise program for cancer survivors called Livestrong at the YMCA. Now there are Livestrong at the YMCA sites across the U.S. We partnered with one of the most trusted organizations in the U.S. to roll this out quickly and efficiently. And now thousands of cancer survivors and their families are benefiting from this program. Our cancer navigators are tracking the requests of the patients that we serve. We truly listen to the voice of the survivor, and we use that as the basis for the work that we do. We're responsive to their needs, and their needs are many. It is very tough to measure the impact we're having. We're in a research study looking at patient navigation to measure its effectiveness. The criteria we are looking at are patient distress, care coordination, and overall patient satisfaction. We look at the number of clients we serve, the amount of money that we save our clients, and the number of services that they receive. We are not a clinical cancer research organization. What we do is provide services and programs to families affected by cancer. We connect them to the resources that they need in their communities. Livestrong provides services in 5 main areas: coping with emotional concerns through counseling and support groups, addressing insurance, financial, and job concerns, providing education about matching to clinical trials and new treatments in development, locating and accessing local resources, and providing information about fertility risks and access to discounted rates for fertility preservation services. Since cancer and its treatment often affect patient fertility, Livestrong created Sharing Hope, a discounted fertility preservation program. All of our navigation services are provided by licensed clinical social workers and are available in English and in Spanish. Since our inception in 1997, we've invested nearly $70 million in community-centered organizations. Today, the Foundation's Community Impact Project funds programs throughout the U.S. that serve survivors and their loved ones. In 2008, Livestrong issued a national call to action against cancer, which spurred both presidential candidates to address their plans for the disease, a first in the history of presidential campaigns. The Livestrong Global Cancer Summit in Dublin, Ireland in 2009 resulted in 300 commitments to the fight against cancer, representing work in more than 60 countries around the world, and an investment in cancer control of more than $200 million. The Foundation's ongoing Livestrong survey for post-treatment cancer survivors chronicles the lasting effects of cancer, including the physical, practical, and emotional changes that remain of concern for survivors throughout their post-treatment lives. And through Livestrong at School, we've helped educate more than 247,000 school-age children about cancer prevention and supporting loved ones affected by the disease. Through Livestrong, we've invested $157 million in education, programs, and policy efforts in the last 15 years. Working with the Economist Intelligence Unit and the American Cancer Society, Livestrong shed new light on cancer's global economic toll with 2 groundbreaking studies in 2009 and 2010. The Foundation has historically been a strong proponent of global action against non-communicable diseases, and in 2011, Livestrong urged world leaders to act swiftly to combat the global cancer crisis at the United Nations high-level meeting on non-communicable diseases. One of our challenges is explaining exactly what it is that we do, because we do a lot. We do provide direct service in the form of patient navigation, and we also are an incredibly effective advocacy organization. Most organizations focus on one or the other, but Livestrong does both, and we do both very well. We would increase the capacity of our cancer navigators online and on the phone. If we could, we would hire more navigators, and then we could increase the number of patients that are in desperate need of our support. There are a number of challenges and gaps in patient navigation that we would address. For instance, we know through the work of our navigators that patients are dying because they're not able to make it to their treatment. We would ensure that every patient would have a safe and comfortable mode of transportation to and from their treatment. We would address this problem as well as other navigation issues.